This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
There's an ethical issue.
It's
Supposed to
Oh,
help
yes.
us.
Medical Dilemma.
Hi, I'm Sonny Del Rosario and you're watching Medical Dilemma. In the old days, whenever someone would suffer a major injury or contract a debilitating disease, the person would just wait to die. And the dying one would hope to ease the pain of death merely through simple comfort measures. Today, medical technology for extending the lives of patients has become so advanced that it has made death seemingly deferrable. Thus, we now contend with questions like, what if I want to end it now? If we have the right to live, don't we have the right to die in a manner of our choosing? With me for the first segment of this show is Dr. Joseph A. Cordero, Vice Chairman of the Bioethics Educational Committee, Medical Education and Research Division of the Makati Medical Center. He's also a member of the Ethics Committee of the Hospital ng Makati. Welcome to the show, Dr. Cordero.
Thank you, Sonny.
Okay, let's start with a few basic questions about the concept of death and dying. Okay, first of all, if the prognosis for a patient is imminent death, how would you proceed to tell the patient of this condition?
Well, I'll be first very truthful in my communication to the patient of his about his illness, and also to prepare the patient if he is in a terminal stage to face all the consequences of his disease with dignity. And if there is some pain and suffering, of course, to alleviate it. And if there's still some chances of cure, of course, I'll give that treatment. But if the patient is already in incurable state, well, just to prepare him for a dignified death.
Okay, assuming the patient is still competent, do you involve the family at the onset when you reveal the condition to the patient?
Of course, the communication is not only with the patient but also with his or her family. But most often than not, in my experience, I don't know with the other doctors, the family don't want the doctor to say to the patient what is his or her real state, which for me is not right. No, it's the patient has a right to know, and I usually try to convince the family that the patient needs to know it and has a right to what's his real condition. And more often than not, the patient knows what is really happening to him.
So they're actually aware anyway of what's
yes,
happening.
they're already aware.
Okay. Now, do patients normally ask a prediction of, how much longer they have to live?
I don't usually give a time frame. What I tell to the patient are the studies, and for example, in cancer, what stage the patient is. There's a predictive time frame in 5 years that he will still be alive. So I think it's only in the movies that the doctor will say.
Only in the movies.
Yes. There's a percentage of survival rate. That's what I tell to the patient. Your survival rate is, for example, in 5 years, at this stage of your disease, 80 or 85% you will still be alive in 5 years.
So when you're discussing these cases of possible recovery, do you also mention to them the chances of actually recovering.
Of course, of course. The doctor's role really is to cure the patient. And if there's no more cure, to alleviate the suffering.
I see. Now, when you talk to the family and the patient, what preparations do you normally suggest to them?
Well,
Like, for example, if there are no more available procedures to treat the patient, so what would you recommend that they do?
if the patient is already incurable or in the
Yes,
terminal
yes,
stage.
yes.
Well, after we've been through all the treatment process, even the experimental one, and really the patient has no chance of recovering, I will be truthful to the patient and the family that the situation is terminal and irreversible. And the best thing that we should do is to prepare the patient for a dignified death, meaning no lessen the pain and lessen the suffering for the patient and the family.
Now, I suppose there is always a discussion about life-prolonging procedures, like
Yes, yes.
use of mechanical ventilators. How is this decision arrived at?
For the use of the mechanical ventilation, if the mechanical ventilation will still treat the patient, I will still advise for that patient to use a mechanical ventilation. But I think you're alluding to the proportionate and disproportionate means. There's a lot of factors to be considered. No? For example, the mechanical ventilation. If you think that the patient will still recover by doing the mechanical ventilation, then you should choose to use the mechanical ventilation. But if you think that using the mechanical ventilation will just prolong the pain and agony of the patient, in which case the natural death is prevented. It is just prevented. So that's a disproportionate means. You have to factor in this will really help the patient recover. Will it do more harm than good to the patient? For a third world country like us, the cost should also be considered, meaning the patient stayed in the hospital for a month, using a mechanical ventilation, and then the patient died. But after that, the whole family must be begging in the street because all the resources were used up. So there's a lot of factors to consider whether a treatment is disproportionate or proportionate.
I see. Now, during my readings about death and dying, I came across this term, advanced directives. Could you briefly explain what advanced directives are?
Well, from my experience, when I was training in the U.S., the first thing that the nurse will ask when a patient is wheeled into the operating room is, do you have an advanced directive? So anybody who undergoes surgery, whether major, minor, or medium, they want that patient to have an advanced directive. Advanced directive is nothing else but like a power of attorney. But
so it's a written document.
It's a written document what the patient would like to happen when he or she is incapacitated and cannot decide for him or herself.
I see. Now, what about the term do not resuscitate order? What is this?
The DNR, or the do not resuscitate order, is requested either by the patient when that patient still has his mental capacity, or the family, meaning they have decided that all further intervention are futile.
Okay.
And or it is disproportionate already to the patient's condition.
I see.
It's the difference between dystonia.
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 Okay. Now, this word, resuscitation, okay, what exactly does it mean and when is it used?
Resuscitation is something you do. It's an intervention. You try to revive a patient who had undergone cardiac and respiratory arrest. So you do this believing that the patient will recover.
I see.
For example, someone had a heart attack or someone had an asthma and they cannot breathe. So you do all this intervention to revive the patient, restart the heart, have the patient breathe again. That's my understanding of resuscitation.
Okay, thank you so much, Dr. Cordero, for that information. It's now time to take a commercial break. We will be right back after a few words from our sponsors.
Whoa.
Many of our products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Why when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other sets of it, so you hear it, you see it, and then you can smell the fireworks.
Now put it quickly by asking where are the practices.
You need a word here what needs to be
Something that I've learned is
words can inspire and words can be strong. Choose yours. Okay? Thank you so much.